Hi, welcome to Fast Intelligent Care. Today we're going to go through our part 3, so our third part series with Callyn Jones, our new clinical educator and occupational therapist at Enable Lifecare. In our previous episodes, we looked at her history going into OT and working in South Africa, so a low-resourced context. And then today's episode, we're going to focus on looking at some of her experiences working in hospital and the community space. So my first question for you, Callyn, is what are some of the biggest challenges that you've experienced working in community versus hospital practice?
I think both have their benefits and their challenges. In the current NDIS landscape, and that's what I can maybe chat about more in the community versus hospital sense. In the community, some of the challenges might be the access to funding, really. So very much dictated to around what you can do and what interventions you can support with what's in someone's NDIS plan. And you have limited options. You can write reports and things like that to try and justify needing additional resources. But a lot of the control about what you want to do and then actually being able to act upon it is really limited by the funding model that someone's operating through. In a hospital setting, that flips slightly. So you might have access to funding, access to equipment. You are supported by potentially a really big team and a big procurement system. But what becomes challenging there is that you might not be able to have the range of solutions available. So there might be things like restrictions in how quickly a piece of equipment can be delivered. And the thing that might be delivered the quickest is what gets factored into because you have bed pressure. You also might have some limited pathways in terms of being able to hire equipment, and you need to be able to hire equipment to, again, get people discharged. So there are other factors that where you might have resources, you need to take into consideration other things that you might not in a community setting in order to be able to prescribe something that is the best fit for someone, but also matches the need of the hospital to safely discharge people, but at a good pace into the community.
Yes. And is there a difference in how you approach your assessments when you're looking at community versus the hospital practice?
I think the challenge is that I generally try to keep my assessments the same, but in the community, what you are able to get is a really good understanding of someone's context, so the environment. You can be in their home and understand when they talk about challenges about limited circulation space, or actually see them try transfer into and out of bed and actually see those challenges. In a hospital setting, you might be having to go off the best information that you have from what a client can report or their family members can report, and have to make the best, the best approximation of what might be feasible. So the assessments don't necessarily differ, but where you can draw information in different settings really changes. So again, in the community context, your assessment, your ability to trial a whole bunch of solutions and see which one might be the best might not be as feasible as in a hospital. If you have that equipment, just in the hospital and you can trial it through multiple sessions, you can really get an idea of what would work best for people. So I think the assessment doesn't change, but different parts become easier or harder as you go along.
You mentioned with the funding models or the funding being slightly different between community and hospital. What is something that you would do if you had limited funding in one of those? Like, what would you consider? Would it just be that, I have to go for a lower cost solution, or what would you consider?
I think the biggest piece of advice that I could have in that space is to really rely on the wisdom of others in that space. So it can be a really big challenge when you're in either of those settings, whether you're in a community setting and feeling like there's limited funding and you don't know what the next step is, or a plan appeal or a FCA report has been rejected. And likewise, in the hospital setting, if you're sitting and experiencing pushback in terms of being able to really recommend a piece of equipment, I think leaning on your colleagues that might have been going through the same kind of thing, whether that's through groups, through supervision, through community options like chatting on Facebook groups, I think it's really important to reach out and see what you can do. So in the community space, some of those things, obviously there's always appeals processes in terms of running reports. I think it's also really important to understand and see if you can get as much reasoning around why something might have been accepted or rejected, because that might then be able to give you a little bit of a lead on another pathway you can go to. And I think in the community, it's also about understanding that there might be options in different funding streams. So if you're in the NDIS, is something more appropriately funded through Medicare funding? Are there other community resources that you might be able to tap into?
Yeah.
And then in the hospital setting, it's a very similar thing. If you need to be able to prescribe a piece of equipment, but it's not on hire, lean on your colleagues, see if there are options to reach out to new suppliers and see if they are open to doing a trial, see if there are options for other funding pathways. So again, there are different programs within hospitals that can allow people to have a little bit more time with equipment or to be able to hire equipment sometimes to help them get discharged. I think it's really important to just keep asking and see where you can find those solutions and lean on your colleagues to try help you along.
Well, that's great. I think within the AT space, it's always great to have mentors and supports. Thank you for your very valuable input. Something that I do want to ask as well as a closing question for this episode is if you have any advice for OTs that are trying to decide between working in community or hospital, what is something you would tell them if they're trying to make that decision?
I think it's an interesting space to be in, and I think you've really got to have an understanding of the kind of OT you want to be. And I know that's hard depending on what stage of your career you're at, but I think it's about trying to sit with yourself and understand what are the things that you value as you've done your clinical education in university. What are the things that meant the most to you? Was it being able to spend time with people? Was it about being able to be fast-paced and see a lot of people and feeling that sense of accomplishment about being able to meet tough deadlines and get people discharged quickly? So I think understanding that about yourself will let you then find the correct pathway, whether that's in a community or in a hospital setting. And even, for example, in a hospital, there are acute OTs that have people that need to get discharged really quickly. And there are subacute OTs that get to spend months, potentially weeks or months rehabbing with someone. There are community-based OTs that are focused a little bit more on case management and supporting people with that transition out of hospital into the home. So there's lots of opportunities, but I think you need to have a bit of a better understanding about yourself and what's important to you in order to find the right spot.
Yeah, and I guess like you said, with hospital, there's different areas that you're working with in the hospital practice itself. So whether it's hand therapy or working in acute, and community is the same. You have your NDIS and aged care. So there is, even though those are two different sections, they have some differences within themselves as well. And then also different life stages that you're potentially working with, whether it's pediatrics or across the lifespan. So yeah, a lot of differences, but thank you for your advice. We would love to go on to our next episode. So stay tuned for the next episode where we'll go into some impact stories, reflections, and lessons that Callyn has learned through her journey. We would love to hear from you in the comments. If you are working in a community or a hospital role, we would love to hear what's your experience been, and we will see you in the next episode.